Hello, welcome back. The topic today is insulin resistance. We all know insulin is very essential to maintain our blood glucose level. It's not only for the blood glucose, it's also very important for protein and fat digestion and metabolism. So, insulin is secreted by the beta cells of the pancreas, which, when the blood sugar rises after having food, so everything is converted into glucose. So, the glucose level in the blood increases. So, the insulin, it drives the glucose into the muscles, into the fat cells, and into the liver, so that we get the energy from the glucose. If insulin resistance is there, what is that? There is insulin is there, but it's not working properly. It's a non-functioning insulin level. So the blood sugar level keeps on increasing. When the blood sugar level keeps on increasing, your pancreas get the signal to produce more insulin. There is more insulin, but it's not working properly. So that state is called hyperinsulinemia. So, okay, the insulin resistance, or where the sensitivity of the insulin is very low. Who are the people, or how to diagnose, or how to look into somebody is having an insulin resistance? Usually, there is no test, but the doctor with the examination history, they can come to a conclusion. So and so might be having insulin resistance. Like somebody is more than 45 years and suppose obese and central obesity. Central obesity is very, 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 very important for insulin resistance. So people with dark skin, that's called acanthosis nigrans, in and around the armpit, thighs, inner thighs, and the neck, and the back of the neck, the dark color, dark, shiny skin, and skin tags, a lot of skin tags will be there, or women with PCOS. These are the people who are prone for insulin resistance. So if insulin resistance is there, it can lead to diabetes. So sometimes temporarily insulin resistance can happen with some drugs like steroids. When somebody has to take steroids for a certain period, that particular point of time, the sensitivity of the insulin goes down, so the blood sugar can rise. That's called insulin resistance temporarily. The chronic one or the permanent one leads to diabetes. So, what are the other tests? Clinical examination and history is very important. Along with that, suppose the blood sugar is high, your good cholesterol, the HDL level is very low, and triglycerides level is very high, and blood pressure. These are called metabolic syndrome. So when these are there, then we can come to a conclusion that somebody has an insulin resistance. Okay, how to treat or combat the insulin resistance? It's first and foremost is reduce the body weight. In body weight, obesity has to be treated aggressively. Second, central obesity. So if you are an Indian, Asian, the maximum hips waist size allowed is 90 centimeters for male, and female 80 centimeters, or half of your height. So keep your waist circumference half of your height. Reduce your weight and eat healthy food. So reduce your sugars, carbohydrates, processed food, bakery items. They should be stopped, and eat more good fat, polyunsaturated or monounsaturated fats, and protein-rich food. And a study says even 5% or even 5 to 7% weight reduction can prevent up to 60% of diabetes occurrence. So reducing of weight can definitely prevent you to get your diabetes. And and lifestyle change is very important. Proper timing of food, balanced diet. So no feast and fast. All these things can lead to insulin resistance and diabetes. And physical activity, very important. When even physical activity, even a moderate physical activity, can bring down your insulin resistance by 50 percentage. Or simply walk 6 minutes after each meal, that can bring down your insulin resistance. So insulin resistance can happen to anyone. It could be permanent, temporary, and it's usually above 45 years. Central obesity, and metabolic syndrome like hypertriglyceridemia, low HDL level, skin tags, shiny skin, black color skin. All these things shows that you have insulin resistance, which can lead to diabetes. So to reduce your weight, do more exercise, and keep fit. Thank you.